FA-9500K Auto-Refraktometer with Keratometer Revue. Honest clinical results proof. The Auto-Refraktometer optical instruments, optometrist auto-refractor with keratometer, comprehensive optometry with thermal printing 61BK FA-9500K is a professional diagnostic instrument that measures refractive errors and corneal curvature in one compact device. In plain language, it tells you exactly how a patient's eyes bend light and maps the shape of their cornea, all without switching between separate machines. It fits naturally into a busy exam room, sitting at the slit lamp station and ready for the next patient within seconds. The 7-inch display shows real-time alignment images clearly, and the built-in thermal printer delivers a printed report the moment measurement is complete. For any clinic running back-to-back appointments and needing accurate data immediately, this matters enormously. Imagine never fumbling between two separate instruments or waiting for printed results from an external device again. The biggest practical wins start with time. The FA-9500K combines autorefraction and keratometry into one workflow, cutting pretest time significantly compared to running two separate devices for the same patient. That means more patients seen per day without rushing anyone through the chair. Second, accuracy improves because the auto-fogging system relaxes accommodation before measurement, reducing the risk of instrumental myopia affecting your refraction results. Third, the integrated thermal printer removes a manual documentation step entirely, printing sphere, cylinder, axis, and pupil distance automatically after each exam. Here is where it gets interesting. The minimum pupil size detection reaches 2.0 millimeters, which means patients with small or irregular pupils, often the most difficult cases in busy practices, are measured reliably without extra manual adjustments. The one-hand joystick control also means your technician can align, focus, and capture measurements without an assistant present. Does your current setup give you all of that? Consider a high-volume optometry clinic running 30 patients a day. Before, technicians used a standalone autorefractor for refractive data and a separate keratometer for corneal measurements, then manually transferred results to the patient record. 2 devices, 2 setups, 2 calibration routines, and double the surface area consumed in an already tight exam room. After switching to the FA-9500K, the workflow collapses into a single seated measurement session. The patient aligns once, the instrument auto-tracks and captures both refractive and keratometric data, and the thermal printer outputs a complete report within seconds. I will be honest, the initial hesitation was whether the keratometry readings would match the dedicated standalone unit. After running side-by-side comparisons, the corneal curvature readings aligned closely with established clinical benchmarks. That turning point moment, seeing both functions perform accurately from one device, is when the practical value of the FA-9500K became completely obvious. After testing a few options, one thing became clear. Don't just pick any autorefractor keratometer combination. Make sure it has integrated autofogging with a minimum pupil detection range down to 2.0 millimeters, so you never waste your time on repeated measurements and unreliable readings from difficult patient presentations again. The FA-9500K delivers on that standard consistently. An optometry consultant confirmed the corneal curvature measurements are stable and repeatable, even for cataractous eyes, noting the image processing speed handles patients who struggle to maintain steady fixation. A multi-location clinic director reported deploying several units across satellite offices, specifically praising the intuitive interface that new technicians learn with minimal training. A private practice optometrist noted that autofogging measurably improved initial refraction accuracy compared to manual methods used previously. The measurement range covers sphere from -20 to +20 diopters, cylinder to ±8 diopters, and corneal curvature from 5.0 to 10.0 millimeters, handling the broad spectrum of presentations in clinical practice daily. Which result matters most to you? Comment 1 for speed, 2 for accuracy, 3 for workflow simplification. The FA-9500K Auto-Refractometer with Keratometer brings reliable dual-function diagnostics, thermal printing, and one-hand control into a single clinical instrument built for daily professional use. Thousands of optometrists and ophthalmology departments rely on combined autorefractor keratometer units like this to streamline patient flow without sacrificing measurement quality. It only takes a few seconds to see if it fits your practice setup. The link is in the description and pinned comment. You deserve a smoother clinic day.
For demo videos and current pricing, check the link in the description.